We have a doctor in the house. We're going to be talking health at this point. Dr. Olatunde Kuti has joined us today. We're going to be talking about a topic I believe has not been talked about enough on many different platforms. He's going to be talking to us about fibroids, its symptoms, and of course, its treatment. Now, I would like to say thank you so much, Dr. Kuti, for joining us. We appreciate the fact that you give us this time. Now, please break down what exactly fibroid actually is for people that are hearing about it for the first time.
Fibroid is just a benign tumor. It's like cancer, actually, of the uterus, but it's benign. When I mean benign, it doesn't spread to the other parts of the body. It's not as aggressive as other kind of cancers. So, and it's usually limited to the uterus. And what's the uterus? The uterus is the female, what we basically call the womb, where the baby is growing and all those things. So yeah, that's where when you have that benign tumor or growth inside the womb, it's called the fibroid.
Okay, so so let me see if I can break this down myself. You're saying it is a type of growth that is found in the womb of women during childbearing years, yes? But what has been said, I know there must have been a lot of research done on this. What do you believe, or what has been said to cause fibroids?
Like every other type of cancer, the first thing first is genetic mutations. So there have been a lot of research that shows that here there are sometimes the genes that are responsible for growth of the cells, they go haywire, they are not replicating this the right way they should replicate, and that can cause the growth of the cell. There are some other risk factors that have been associated with it. Number one, African woman, I don't know, for one reason or the other, we are prone to having more fibroid because we are black. Then use of steroids. So people that use oral contraceptives, pills, in association with growth of fibroid. Then not having child early. Not having child early is also a risk factor for having fibroid. Not breastfeeding enough, even after you have a child, not breastfeeding enough, is also another risk factor for fibroid. So those are generally common risk factors that are associated with it.
Okay, so now that we've heard about the risk factors, one of the ones that came to mind quickly was not giving birth early enough. You know, not giving birth early. In terms of age, how early or how late is at most risk for getting fibroids?
The age of 30 to 35, but once you're approaching the age of 35 years, you have more risks of having fibroid because, like I said earlier, the more you expose your body to steroids, the more likely the tumor will grow. And what happens with not giving birth early is that you have a lot of menstrual cycle, like you are menstruating almost every month. And when you menstruate, your body produces steroid. So that steroid would stimulate such growth in the uterus. So that's why if you give birth late, within 30 to 35 years, then you are more likely to have fibroid.
Okay. Now, the fact that these growths appear in the womb area, now this must cause certain risk factors for childbirth. Are fibroids known to be, because I've heard so many stories about this, known to be in the womb at the same time as a child, or are they known to only occur when women are not pregnant?
They are pregnant or when they are not pregnant. In fact, in some cases, part of the complication of fibroid is not being able to conceive.
Okay.
Some people that actually conceive, but they have this fibroid, they can have complication during childbirth, whereby they bleed a lot after childbirth, or the baby is not well positioned, or they go into labor early. Because this growth is within the womb where the baby grows. So if the tumor is there, the baby won't have enough space to adequately grow. and that can lead to other complications. While for people that can't conceive, yes, fibroid too can also prevent them from being pregnant, depending on the location where that swelling is. So if the swelling is located in the muscle of the uterus, it can prevent pregnancy.
Okay, so let's talk about the most aggressive forms of treatment now. We're seeing quite a few images there of different sizes of these tumors and where they could actually be in the womb. What is the most aggressive treatment? We know that with cancerous growths, there are things like chemotherapy and the like, but what do people do if they find out they have fibroid?
Fortunately, the best treatment is surgery, actually. Surgery is to remove the tumor. But depending on the size of the tumor and where it is located. So for some people, they have the tumor, but they are very small in sizes and they don't cause any symptom. They don't cause any discomfort. They are just there. For that kind of, for those kind of people, we don't really do anything. We just keep monitoring it, doing scan to see if it's growing or not. However, for people that have a bigger tumor or tumor that is causing them discomfort, such as they are bleeding excessively, they're having abdominal pain, things like that, you advise them to do surgery. And there are two types of surgeries that you can do for it, depending whether you still want to conceive or not. For people that still want to conceive, so we basically just remove the tumor. For people that don't want to conceive, an option for them is to remove the womb totally. There's a new kind of treatment, though not as common as surgery. What they do is they block the blood supply to that tumor. So by blocking the blood supply to the tumor, it shrinks the tumor. It's a new type of treatment. Yeah, we have been doing this in Nigeria. I think Nigeria had the first treatment in Africa or something, that kind of treatment, but it's not as common as surgery right now.
All right. Now, Dr. Kuti, I have to say a big thank you to you for coming. I just wanted to mention, I had heard that there are some herbal remedies for this and some foods and fruits and things like that that some people have advised people with fibroids take, but we don't have enough time to talk about it now. But please talk to us on social media. If you have any questions for Dr. Kuti, make sure you use our hashtag WakeUpNigeria on TVC. Visit @TVC Connect with your questions. Dr. Kuti, it's always a pleasure having you on the show. All right, at this point, we have to, I think we've given you a lot to reflect on, and for those of you who see someone with a protruding belly, you never know if they have some underlying issue or not. So keep that in mind. We have to take a quick break now, and we'll be back with more on Wake Up Nigeria.